Hello, this is Dr. Stanley Lang. Welcome to this video. And this brief video is designed to kind of review very briefly how powerful stress is in affecting heart disease, causing heart disease. And I wanted to share a story of a real story of a patient that I saw not so long ago who had been having lots of stress because of his work. And then he started to develop a rapid increase in what are called palpitations, which is where the heart is felt to be beating, and that could be fast or hard or skipping beats. All of that kind of falls under the category of palpitations, and that's what he was having. So he ended up going to the emergency room, and this is a case where stress of chemical effects were actually demonstrated. And in his case, his potassium level was below normal. Now, this is a sort of a middle-aged man with no medical conditions that should cause potassium to drop, and also not on any medications that should cause potassium to drop. So why did his potassium drop? Well, one of the things that happens with chronic stress, especially when it's severe chronic stress, is that a hormone called cortisol gets released, and if it gets released in large enough volumes in the body, it basically causes the kidney to stop holding on to potassium well, and so the potassium drops. The long and the short of it is that the effects of emotional stress cause a physical change in hormones that then cause a physical change in how the kidneys work, which then causes a biochemical change, electrical change in how the heart works. So this ripple effect happens all through the body all day long with chronic stress, but most of the time we don't have such dramatic evidence of it. In this case, there was very dramatic evidence, and the symptoms went promptly away when the potassium was fixed. But the stress is still there, and this person, as possibly you, needs to learn ways to dramatically decrease stress, or it's going to have more serious effects. And stress affects our immune system. It affects lots of different things that ultimately affect developing heart disease. So years ago, before we had the ability to put stents in the heart, those are the little devices to open up blockages, there was very promising research on stress reduction preventing heart disease. Well, that research basically stopped once it was possible to fix little blockages in the heart arteries with a stent. But there was really good evidence that the right kind of stress reduction can dramatically decrease a person's risk for heart disease. So I want you to be aware of that and become adept at understanding how stress is affecting you, and being aware that there's a lot of different things in the physical, emotional, and spiritual realms of your life that dramatically affect stress, and you can choose to do those things. So I hope you take this to heart, no pun intended. God bless, and have a great day.